Heart disease refers to several conditions, including coronary artery disease, heart attack, and stroke. Heart problems, including coronary artery disease, are often caused by a buildup of plaque limiting blood flow to the heart.
Heart disease is one of the 4 diseases recognized in the 3-4-50 model. As of 2020, 7.2% of the adult population in the United States were reported having coronary heart disease, and there are about 805,000 new heart attack cases reported yearly. It is the leading cause of death in the United States and even was in 2020 with the COVID-19 pandemic. Over the past decade, there has also been an increased global incidence rate of 17.1%. Based on statistics reported by the CDC, heart disease is roughly equally prevalent in all racial and ethnic groups as well as in both sexes. Throughout our presentation, we'll be following these 2 patients. Our first patient is Phil, who is a 65-year-old white male and is coming in today for his regular checkup. And our second patient is Bob, who is a 65-year-old Hispanic male and is coming into the ER with symptoms such as shortness of breath and chest pain. Take a look at their charts and see their answers to the self-reported questions and look at the difference and think about how it might affect their results.
Here are some ways heart disease can be prevented. First off, exercising regularly, avoiding tobacco use and smoking, having a well-balanced diet, having great sleeping and stress habit skills, and making sure you go to your regular checkups.
All right, let's take a look at some interventions for cardiovascular disease. First off, we have smoke-free policies, which reduce both smoking and secondhand smoke exposure in public spaces. One study found that these policies in workplaces decrease the risk for cardiovascular disease by 46%, so they are very effective. Next, we have a healthy diet. This is really important because unhealthy diets and obesity are some leading risk factors for cardiovascular disease. So implementing healthy habits through school lunches that include balanced meals is one effective way to reduce childhood obesity and therefore hopefully prevent cardiovascular disease in the future.
Let's go back to our 2 patients here. Phil's habits align a lot with the suggested habits that Celeste and Sarah previously mentioned, so it seems to be paying off, and there is currently no concern of development of heart disease for Phil. However, Bob's evaluation in the ER is concerning, so the next step would be to screen.
Routine screening can help detect heart disease early and improve health outcomes. The Framingham score is one tool that you can use from home to determine your risk for a heart attack within the next 10 years. In addition, blood tests and chest x-rays can screen for heart disease, but these usually require a visit to the doctor.
Screening for Bob included a blood test and a chest x-ray. Results from his blood test revealed that there was heart proteins in his bloodstream, which is usually an indication of damage from a heart attack. A chest x-ray then confirmed his heart's condition. So now the next step would be to treat him appropriately.
There are a lot of misconceptions about heart disease. First off, if you have heart disease, it's important to stay active to strengthen your heart and improve your health. Make sure to check in with your doctor about what amounts and types of exercise are appropriate and safe for you. Second, a heart attack is not that big of a deal. While not all heart attacks are life-threatening, they are red flags, so it's important to check in with your doctor and prevent any further damage.
Treatment of cardiovascular disease includes medicines such as aspirin and blood thinners, which help lower high blood pressure, which is directly correlated to heart disease. Procedures such as angioplasties, bypasses, and transplants are also recommended. And implementation of better habits such as eating, exercising, and smoke reduction is recommended.
Based on the conclusion that Bob suffered from a heart attack, he is given a list of medications, recommended to begin light exercise, and is urged to schedule follow-up appointments with a cardiologist and set himself up with a regular doctor. And it sounds simple, but we have to keep in mind that it may not be that easy for everyone. So it's not equally as easy for everyone to get the same amount of care or to even get that initial care from the beginning because of some disparities within the healthcare system, such as insurance. According to data, 8% of white adults are uninsured, while a total of 25% of Hispanic adults are uninsured. And while this data is from 2018, based on this trend, we can still infer that Hispanic adults are less likely to be insured than white adults. So patients like Bob may be more concerned about affording the care rather than seeking the care, making them less likely to actually receive proper care. Luckily, there are movements to ensure adequacy of services.
Adequacy of services. In 2010, the Affordable Care Act improved heart failure through the regulation of insurance and coverage expansion. In the same regard, nursing homes have had significant expansion of skills to take care of elderly patients who have heart-related concerns. And within this, health insurance has expanded its networks and coverages, which affects patients in a positive manner. In the same light, clinicians have become more aware of how legislation affects heart failure in clinical practice.